Hi, my name is Dr. Carl Truesdale, and I am a double board certified facial plastic surgeon, and I work in Beverly Hills, California. I perform facelifts, rhinoplasties, eyelid surgery, and much more. My job is one as an entrepreneur, a businessman, a husband, a father, but a surgeon who gets to transform patients' lives. Beyond the surface to me means the transformation and the journey that my patients go through. It's not about the external, it's not about the facade, it's not superficial. We are going to dive in to what makes my patients tick, a little bit about my life, and all the drama of owning and operating a practice in Beverly Hills, California. It's plastic surgery, but it's so much more. I'm from Corning, New York, and a lot of people haven't heard of that. Or if you have, you probably have heard of Corningware or Corning Glass. It's a small town in upstate New York, and basically I grew up in a very rural area. Not that many people, and definitely no plastic surgery. I grew up with my parents and my siblings, and a lot of other family members who would come and live with us as well. Some of my memories about growing up, it was a loving home, loving household with a lot of support. I think a lot of the reason why I am who I am today is because of my parents. My parents instilled in me dedication, hard work. My dad, who's a scientist, definitely brought that analytical science mind to the table, and I definitely got some of that, the introvert, where my mom is the extrovert.
Hi there. Well, first of all, I have to give you my signature hello, which is eeeeeoo. And my name is Linda Truesdale. I am from Corning, New York, relocated to Conyers, Georgia recently. Carl's always been that type of person, wanting to know more than you thought a child his age should know. So he was always challenging me to step it up, because it's like there was no limit. The sky was not the limit for Carl. And very busy young boy, one who read encyclopedias, who just had to know. Carl was one that I need to know. If I don't know, I had to call my husband, call somebody, we got to get into books. So it was always never a dull moment with Carl.
Pase.
Hola.
Hi.
¿Cómo
Hola.
está?
Bien, gracias.
Bienvenido a mi oficina.
Gracias.
Me llamo Dr. Truesdale. Our next patient is Ava. Ava is 63 years young and lives in the Los Angeles area. Ava doesn't speak much English, or her English is not as good as her Spanish. So this posed a very interesting opportunity for me to use my Spanish.
Mucho gusto.
Mucho gusto. Pues, dígame, ¿en qué puedo ayudar? Many of you know, many of you don't know, I actually studied Spanish in college, and I double majored in biology and Spanish. I used the biology as a doctor. I use the Spanish in conversational, especially here in Los Angeles. There are very many Spanish speakers, and people find me and love the ability to communicate with me, and I love using the language. Cuando envejecemos, dos cosas ocurren. Uno es que la cara se cae, y la otra es la grasa y los músculos se caen también, ¿ok?
Okay.
Y en tu caso, mira, hay un flacidez del piel, del cuello y también en la cara.
Sí.
Y por eso necesito levantarlas.
Mi nombre es Eva Torres. Soy de Guatemala, vivo en Los Ángeles, California. Tengo 63 años. Estoy en California desde los 17 años. Estudié en Fairfax High School por un poco de tiempo nada más. Soy ama de casa.
Y mi técnica es un tipo de facelift especial. Se llama Deep Plane Facelift. Es un profundo levantamiento de los tiejos, ¿ok? Abajo los músculos y libre todos los ligamentos que mantengan que los tiejos son bajos.
Bajos, ok.
Bajos, sí, gracias. Y después levantarlas en una posición alta, ¿ok? ofrece, mira, una posición buena, ¿ok? Las líneas aquí es más plano y esta parte, este grueso no va a ocurrir. El cuello va a estar levantado y linear. When she came in and she started having her consultation, I realized very quickly I needed to switch my brain over into speaking Spanish. So we did that. She's bothered by heaviness of her face, her neck, as well as the distance between her nose and lips has gotten longer. So we're gonna perform a lip lift for her. We're also going to do a revision upper blepharoplasty, which is going to take care of extra skin above her eyelid. Unfortunately, she's already had this surgery done last year, but it was an inferior result. The scars are actually visible and the amount of skin that she wanted actually lifted was not. So we're gonna revise that for her.
Estoy esperando, no por mucho tiempo, la decisión de hacérmelo fue porque mi hija me enseñó video del doctor Truesdale y me gustó cómo quedó las personas que estaban en el video, cómo quedaron personas mayores y cómo quedaron después de la operación. Me gustó mucho y entonces decidí, ¿por qué yo no? Yo también quiero hacérmelo.
¿Hay otros problemas? ¿Hay otra meta que tiene con tu cara?
La parte de acá abajo y el párpado que todavía falta, yo creo.
Por eso necesito hacer una cirugía que se llama blepharoplastia. Blepharoplastia hay dos maneras. Mira, para esta parte hay dos cosas. Hay un poco de grasa aquí. Necesito quitarla, sacar de esta posición. Hace que es más plano. Y también hay demasiado piel aquí. Y necesito cortarla. Sí. Con esta hay una cosa semejante, ¿ok? Hay dos cosas. Hay demasiado grasa aquí, pero aquí se falta. Okay. Necesito añadir un poco de otra parte de tu cuerpo con liposuction.
Mi hijo pequeño se graduó de la Universidad de San Francisco y hace poco. Entonces dije, bueno, un poco para mí ahora, para mí, porque siempre he estado pensando en ellos, del dinero que tenía siempre para ellos o para cualquier cosa. Entonces ya decidí que era mi tiempo y dije, yo lo voy a hacer.
Una cosa que no hablemos, no he discutido es de los labios y con el tiempo, con pasa de la edad, la distancia entre los labios y la nariz se aumenta, crece. Okay? Y mira, cuando crece la labia aquí se parece más pequeño y la forma no es tan distinta, ¿me entiendes? Sí. Como un Cupid's bow. Cuando levanto el labio, mira, ocurre. Es un poco más joven.
I wasn't surprised, but I was like, Beverly Hills? Because I'm thinking, geez, we just moved to Atlanta area, and he's talking about West Coast. And California was always another place that I always said that I wouldn't come to because the traffic just bothered me. But when he said Beverly Hills, I was like, oh my gosh, Beverly Hills. And then when he said Rodeo Drive, I'm like, what? Are you serious? I'm like, so I've never thought that, oh my gosh, Carl is just dreaming too big. Because if he didn't come that way, then I probably would have questioned, well, geez, why not Beverly Hills? Because Carl has always felt like, why not me?
Imagine if you were a plastic surgeon and your mom is seeing you do all these before and afters. she's gonna ask you about plastic surgery. And
So I've been asking him for the past couple of years. I'm like, so what do I need? And he would say, Mom, you don't need anything yet. You don't need, and I'm like, well, maybe I need. So now I'm at the place where I'm thinking, he's thinking, okay, maybe I do something.
my mom, even when I began and she knew that I was gonna become a plastic surgeon, hey, what do I need? What do you think about this or that? And so over the years, we've thought about what we can do for her. So I have a surprise.
Okay, what?
I think I'm gonna do my mom's surgery.
Oh, she's ready?
Well, we'll see. You know, she definitely wants to do it. You know, she's been talking about it for years.
Years, forever, since you became a facial plastic surgeon.
I mean, before that. I mean, even when it was like, I'm a doctor, hey, maybe you can do. So, yeah, we're gonna start planning for it.
Okay.
I'm excited because, you know, she's gonna look years younger.
She's gonna look like she did when you were growing up.
It's gonna be crazy.
It's gonna be crazy.
Yeah, so, you know, there's definitely, you know, we want to do it as safe as possible.
Yeah.
So we have to get the clearance and all of that.
I know
I
you
wouldn't
can.
do anything that I thought would be, you know, dangerous or
Yeah, I know you
harmful,
can.
but it's definitely gonna, you know, it's definitely not a standard thing.
I
that
know. You're
people-
gonna see some of your own structures under there.
I
See your
know.
genetics right
See
up right up close and personal.
really up and close and personal, right? Hola, hola linda.
¿Cómo está?
Bien.
Ay, qué bueno.
Guapetonia.
Ay, gracias.
¿Cómo está?
Ah, muy bien, gracias. Mejor. Me
Parece
siento mejor.
muy guapa.
Ah, gracias.
Muy linda.
Gracias.
¿Qué piensas sobre sus resultados?
Bien,
Bien.
yo soy satisfecha, sí. Muy
Bien.
satisfecha.
¿Y tu vida cambia?
Ha cambiado porque yo me siento mejor.
Bien.
Me siento más segura, más joven.
Más joven,
Ujú.
sí. Pero el proceso no era tan fácil como normal.
No fue.
Dígame
no fue
sobre
muy
esa
fácil.
experiencia.
Bueno, la primera semana de la cirugía todo fue bien. De la cirugía cuando usted me la hizo, pasé una semana bien. Después fue el problema.
El problema. Dr. Truesdale, Eva called in. Behind her ear, looks like it's separated a little bit. So I saw the photos. I said, bring her in. Always have to see the patient. If there's ever anything going on, super available. So I brought her back into the office. It did. It looked a little red, maybe a little infected under the chin, a little red as well. And so I said, let's give you some antibiotics. Let's see how you do. Keep me updated. I want to see you in the next couple of days. Unfortunately, it looked like the infection was getting worse. And then she spiked a fever. So at that point, we talked about different things we could do. This is the hard part about medicine. As good as you can be, sometimes things happen. And so unfortunately, her fever progressed despite the antibiotics. And I said, listen, I think you really should go in to the hospital so they can give you some IV antibiotics and make sure that you don't have sepsis or infection that's in your bloodstream. She went in, and unfortunately, it did look like that. She needed the hefty dose IV antibiotics that I could not give her oral.
Me siento bien. Tuve unos problemas después de la cirugía, una semana después de la cirugía. Me dio una infección en la parte de abajo, según los doctores del hospital. Pero todo, estuve con antibióticos y todo pasó y ahora me siento muy bien.
Tenía nervios, muchos nervios, y me sentí como muy vulnerable. ¿Cómo se dice? Vulnerable.
Sí, vulnerable.
Sí, sí, porque yo quiero que todo pase perfectamente para mis pacientes, pero en ese caso no tenía el poder para cambiar su experiencia.
Mi experiencia, sí. Sí, fue algo bastante difícil para mí también.
¿Y su familia?
Ajá. Y mi familia, sí.
Es
11.
muy raro para mí para tener una
Ajá.
infección con mis pacientes.
Sí,
Y
sí.
en ese caso, era muy importante que visita la hospital.
Al hospital.
Y para tomar los antibióticos intravenosos.
Salí del hospital y a los 2 días ya me sentí bastante bien. Bastante bien. Y cuando miré en el espejo, ya me miraba bien. Para mí es bastante bien. Sí, ya no tenía el my droopy eyes and like, ya no sé qué le llaman. Ajá.
Aquí, en esa parte y
Sí.
en esa parte, pero los ojos más abiertos.
Sí.
El
labio también
el
está
labio
mejor.
también, mejor. Y puede mirar sus dientes fácil.
Sí.
Sí.
Sí, está
Sí.
bastante bien.
Y el cuello y todo aquí, el
Ajá.
rostro es mejor.
Sí, bastante, of course. Bastante mejor. Aún con lo que me pasó, me la volvería a hacer. Claro que sí. Y vendría aquí con el doctor Truesdale, que le doy confianza. Buena persona.
And so she actually needed to go to the hospital for a couple of days for antibiotics. Thankfully, everything turned out fine. But when these kind of things happen, you really have to dig in because, you know, I don't ever want anything bad to happen for my patients. And most of the time, plastic surgeons will not talk to you about their complications, but every surgeon has them. You know, I heard something when I was in residency in your training, and a person who doesn't have complications is not operating. And so the thing that's important, it's not the problem, it's how you deal with it. And so for me, it was really important to identify and counsel her on, listen, we need to get you in the hospital, get some antibiotics. And she got better, and now she's fine.
Yo diría que me siento más segura, yo creo, ahora con las fotografías, que antes que me escondía de la cámara o no quería, decía no pictures, no fotos. Más segura, más con confianza en sí misma. Es como si uno cambia, uno le da más ganas de vivir, más fortaleza, más decir, yo puedo hacer más cosas. No.
Every single type of person, doesn't matter what language you speak, what color or creed, it has a face. Every single person has a face, and your face is you. And whether you speak Spanish or English, Korean, Japanese, you still have a face. And one amazing thing about language is its ability to connect people. I had no idea when I started learning Spanish years and years ago that one day I'd be able to connect with patients. And maybe that'd be the reason why they chose me, because this doctor, even though he doesn't speak perfect Spanish, is someone who took enough time to learn a little bit more about my language, maybe a little bit more about my culture, and he cares. And so take a little time to connect with someone that you know, or maybe that you don't know. Maybe looks like you, or maybe doesn't look like you.